One more thing that's been happening very often. This week, the video has already come out, and this is the second one this week with the same situation. Pay attention. A teenager dies from appendicitis after going to the emergency care unit 8 times and initially being misdiagnosed with a urinary tract infection. I have the whole context here. For God's sake, people, for God's sake. Nurses, doctors, we study how to identify pain in the right hypochondrium or in the flank or on the right side. I know where you wanted to imagine where the vermiform appendix is located. There are some techniques for that. Remember that you press and then release quickly. What's the name of that? What is that sign called? We study that. Unfortunately, that's something I remember, that I studied back in 2007. I still remember it today. I know how it works and the names. It wasn't just because I was a semiology monitor. It really caught my attention. I thought it was cool. With a simple gesture using propedeutic methods, we can help the patient get an initial suspected diagnosis of something. There are other things to confirm, and it feels like this is getting overlooked, guys. If the person had gone once and gotten the diagnosis wrong, the patient 8 times, urinary tract infection. That really upsets me because if it were something complicated like a diagnosis without a clinical method or clear path, I could understand. Patience, okay? Then it would have to be a specific test. And then, for example, a person who has a headache, but their headache isn't just any headache. It's not a migraine, it's a tumor. And this tumor isn't in an area that a computed tomography scan can detect. It's in a more hidden area, so it would have to be in magnetic resonance imaging. Patience. Look at the level of complexity we're talking about. A problem that a computed tomography scan under the stroke protocol wouldn't detect. It would have to be in magnetic resonance imaging. Look at the difference in level. Now we're talking about appendicitis. Man, let's not go there for the video. Let's go to the video. According to the family, the patient sought care 8 times in the public health system in Canoas, with severe abdominal pain in the kidney area. Over these visits, she received medications and was given possible diagnoses such as urinary tract infection, anxiety, and Malta, right? And other causes considered less serious. Even with repeated visits and progressive worsening, the correct diagnosis only came later, already in the hospital. When a computed tomography scan showed appendicitis, they had to send the patient to a hospital to get a computed tomography scan to see that it was appendicitis, man. The patient underwent surgery, but her condition progressed to a generalized infection, that is sepsis. She died on April 9, 2025. The City Hall reported that it opened the union to investigate the facts and prevent similar situations from happening again. What hurts, besides the loss, is the sequence of events. Why can't persistent abdominal pain, worsening after discharge, and frequent return to the service be treated as nothing? This needs to trigger an existing alert, require careful reassessment, complete documentation, clear criteria, and return guidelines. Objective. Guys, it's tough, right? The daily routine of seeking care. So let's go. You're the triage nurse. Your patient comes in for the first time and says, I'm having pain here anyway. Okay. So, if she says she's having pain on the right side, what do you have on the right side? In the back region, we really have the kidneys, but what about the front region? We have the liver higher up, further down, what do we have? We have the gallbladder, and further down, what do we have? The intestine? Which one? You can't get the intestine wrong, huh? The small intestine? And the large intestine is that brownish part there, right? So, the first point, what I notice is that unfortunately anatomy is being lost among the professionals who are coming in or are already working. Anatomy is a subject like this. I don't even need to say it, man. I don't even need to say that this is a foundation. If you don't know the human body, man, you're a terrible professional. If you say it's about taking care of anatomy while watching this, I'm sorry, you're a terrible professional. The most basic subject in the world, you work with humans and you don't know the parts of the body. I'm not even mentioning physiology, which is much more complex, and I know that. And I've had many students who were in the 4th, 5th, 7th, 8th year, even graduates who had trouble understanding where the organs were. So guys, come on, for God's sake. Appendicitis in semiology, specifically, if you want to get a book on that, I'll recommend two to you. Alba Lucia Botora-Leite will teach you. Just follow there in the physical exam section, in the part about the abdominal and digestive system, and it's perfect. Celeno Porto, both of them, there are others too, but these two, my recommendations are excellent. I study with them, I recommend them. We have classes here for our students with both references, so there's no excuse. In the propedeutic methods, in the digestive system section, you will learn to use the 4 propedeutic methods. Regarding the abdominal or digestive system, there's an order to follow, but I won't give a digestive system lesson in this video. Obviously, but it's just for you to understand where this was taught to you, or if it wasn't taught. Your education was lacking, and while it wasn't your fault, you still share responsibility for it. You can still catch up. There's only no time after someone dies, right? So, study semiology, but if you have trouble with semiology, take a step back and study basic human anatomy, then you move on to semiology. Because here's the thing, man. Pain in this region, for example, renal colic, kidney colic, nephritic colic, anyway, whatever you want to call it, right? It's an excruciating pain. It's a sharp pain, man. Nobody can stand having this pain for long and just go back. The guy will go. As soon as the medication takes effect and the stone reaches a comfortable spot, the pain will stop. But there will be bleeding because depending on the situation, it will tear part of the smooth muscle there. So a lot of things can happen, like a urinary tract infection or something like that, man. Burning when you pee, man. I'm not a doctor. I didn't study medicine. I'm not going to study medicine just to have this knowledge. So man, a urinary tract infection typically presents with what? A burning sensation when urinating, a burning feeling when you pee. The person is urinating very little, the urine is very concentrated, the person drinks little water. All of this contributes to a urinary infection. And look, obviously if the person is saying this and someone mentioned a urinary infection, where's the lab test? Because the lab test would already help to see if the leukocytes had increased, or maybe the person was biased into ordering tests and didn't do a physical exam, and thought that the leukocyte change was a urinary tract infection and not appendicitis, because both infections can have what? An increase in leukocytosis. Whether there's a left shift or not depends on the timing. So guys, let's go, it's tough. The thing is, and it's basic, you have to sit down and stop thinking that artificial intelligence will save humanity if you don't sit down and do the work. And study anatomy however you want to study it. Whether it's with a digital table, with anatomical models, rubber pieces, or real human parts, I don't know, but you have to know anatomy. If you didn't study health, that's not even a privilege, that's basic. Man, if you don't have that, sorry, this is a professional test. I've said this before, it's the least someone claiming I am should have. A health professional needs to understand where things are inside the human body, the organs, the viscera, anyway, man. If you don't have that, man, if you don't have the basics, study. Then you move on to semiology. There's no point in trying to study reports or memorize lab tests. Why? There's no point in having tests if you don't have clinical knowledge, if you don't have reasoning, if you don't think about the test and make the right correlations, right? Unfortunately, another victim of poor medical care, someone who goes to the doctor 8 times and ends up dying. The care was weak, very weak. And she was definitely not seen by the same professionals, right? By the same professionals. She must have seen several. So you notice that it's like a domino effect, right? People read what the person had from a recent appointment, kind of from that, right? Copy and paste, right? Anyway, this happens quite often, unfortunately, guys. Study or get out of the healthcare field, go do something else. If you want easy money, there are plenty of ways to get it. Medicine is no longer the profession it used to be, or that it was 30 years ago, right? If the guy studied medicine, he's doing well in life. If you want to be a doctor, be a good one. If you want to make money, get out of medicine. Because if you just got here right now, man, you arrived at the worst moment in medicine. Of course, there will be good professionals, very well paid, but they are good and will be well paid because they are good. Now, the guy who's bad, who doesn't really know what he's doing, that's the guy who's going to harm the population, and he still won't have good financial compensation. Sad, right?